It's a series of webinars that the ELSA is organized. It's the third one. Then every 2 weeks we are planning, and we are trying to focus on the most common topic, has ventral hernia, gastric cancer, colorectal, and more, and some other new coming, like the role of women in surgery that I think is today very important. So the webinar will be on either on Friday afternoon or Saturday, depends on the time, the schedule, if we have a foreign speaker from other country like Europe or US that we will try to involve. We are really glad that Medtronic is supporting us in these events. As you can see, the first two webinars were focusing about the role of MIS and COVID, because we were in the thunders of the pandemic at the time. And we are glad that as a society, we come up with some recommendation that for the laparoscopic surgery that goes from the local spread, widespread, to the recovery phase. And this manuscript will be published on surgical endoscopy soon. And we hope to translate in almost several languages all over Asia, so there can be a guideline for all the society. Please, to keep update with all this initiative, download the ELSA app. It's available both on Apple Store and Google Play. You will receive notification. You will receive all the link to keep updated with all the activity. As you know, these events are on our YouTube ELSA channel. You can link and you can follow. Like the previous one, you can see that all the video, the presentation will be live on YouTube, and you can watch later on. We are trying to upload also the PDF file. Same, you can follow ELSA Facebook page, and ELSA Facebook page is a good interaction for all the participants, all the people who have questions, and you can contact us. Luckily, join us in 2 weeks' time for the ventral hernia. We have top speaker. We have Victor Radu from Romania, Maki Failono from Philippines, and Dr. Pawan from Thailand. And we will have also a lot of panelists from Indonesia, Japan, and so on. We'll ask Jeffrey Kim, that is a director of PACE Medtronic, to give us a welcome.
Okay. Can you hear me, Professor?
Yes.
Okay, thank you, Professor, for giving an opportunity to deliver a congratulatory message on behalf of Medtronic. Honorable ELSA President, Governors, and members, I am Jeffrey Kim, the PACE Director of Medtronic Asia Pacific. We, Medtronic, are greatly honored to partner with the endoscopic laparoscopic surgeons of Asia and in your webinar series. Training and education are vital objectives to ensure better patient outcomes. We assure you of our sustained commitment to these objectives and share in your efforts. We are in extraordinary times. The COVID pandemic has affected all of us in a professional and personal manner. It has brought about fewer elective surgeries and reduced revenues for everyone. It has also made the promotion of training education more challenging. Nevertheless, your organization has been relentless in your efforts to provide avenues towards continued medical education. We salute you for this. Today, we affirm Medtronic's commitment to all ELSA leaders and members. We will continue to partner with you in your training education activities, most especially during this demanding period. It is important to keep in mind that better patient outcomes remain to be utmost importance. Rest assured that our relationship will continue to strengthen as we share our common goal towards taking healthcare further together. We truly believe as critical times like this, we will overcome this crisis stronger together. Thank you.
Thank you, Jeffrey, for the kind work, and we really thank as a society, as a community in Asia, surgical community, for your support that is not related to any commercial promotion and anything else. Let me introduce now Professor Sutep, that is the ELSA president, to welcome all of you.
Good morning to everyone, dear all ELSA members and friends. we witness the pandemic involved anywhere in the world. But as the society, ELSA would keep doing the academic activity going on. So I would like to thank our scientific part, especially Professor Lomanto and Asim Shabbir for arranging and introducing the webinars. So as mentioned earlier, that the academic collaboration will be going on, and we will see you for twice a month. Today, I would like also to thank all the speakers, panelists, chairperson for your contribution. So without any delay, I would give this mic to Professor Lomanto and Asim for running the webinar. Thank you very much.
Thank you, Sutep. Thank you very much. And I think leadership is very important for a successful society, and we are very glad to have you. So, Asim, you want to go on and start with introducing everybody? The game is up, the ball is up to you.
Hi, a very good afternoon from Singapore, 13 minutes past the hour now. So very well, thank you very much. Thank you to all my speakers, especially Michael Talbot, Nanda Kishore, and to Mahir Osman. So you can see right from one end of the continent to the other end of Asia, we've tried to bring Asia together. Hopefully the rest of the Asia and the rest will compartmentalize and come along with us and work with us. So really thank everybody. Thank you to all the chairs of the sessions. And I will introduce you as I come along. And first and lastly, thank you to all the participants who are here, who make this webinar possible. 6, 7 of us would sit down and do a webinar, but it wouldn't be if you weren't here for us to do all this. So while I do that introduction to the speakers, why don't I get David to ask for the first poll for the audience. I would like all the participants, as the poll goes up, this poll is regards to leaks after bariatric surgery, since our first topic is going to be managing the leaks by Dr. Associate Professor Michael Talbot, who is the head of upper GI surgery at St. George's Hospital and the chair of surgery at St. George Private Hospital in Sydney as well. He's currently the president of the Australasian and New Zealand Metabolic and Obesity Surgical Society. His unit does about 1,500 bariatric procedures a year, a very large volume center. And apart from bariatrics, he has interest in esophageal physiology, oncology, robotics as well. So it is great honor and pleasure to have him with us. So panelists and hosts cannot vote. So participants, please, it's time to start voting. David, you want to go and do the vote?
David, unmute.
Okay, I already started, and yeah, we will wait the panelists. Already, the management of leaks is in progress, the poll. And we hope that we have 150 participants that will answer. Only one, please.
Sorry?
Only one participant.
So participants, if you take the polls, you can just click, it's just a single option. You just click on the single option and you'll be able to vote, and we'll be able to see what your poll is like.